As care becomes a little bit more inclusive and adaptable in its locations particularly, we've got to consider how our designs fit in with this evolving health model and how it's going to impact each of us and our work. If you're truly going to put yourself in your customer's shoes and use tools like journey mapping and co-design, then you're going to be rewarded with some amazingly powerful insights from the customer's or patient's point of view, and your design will start to respond to the problems they have, not make the patients conform to the way things have always been done.
From a budget perspective, we need to be making bigger loading docks. We need to be allowing for the separation of waste. We need to be thinking about all of those operational aspects. But, when you're trying to tightly fit in and reconfigure scope and reconfigure a plan, quite often it's the sustainability things that get value managed out, and then you're focused on the minimum.
We need to build appropriate care in the right places, and that needs to involve a lot of network scale planning, not just we're announcing a new hospital at this location. What does it need? How big can it be?
Certainly from a Victorian point of view, it's like taking the veil off and saying, actually, all the things that we project don't always get funded in the first 5 to 10 years. Why wouldn't we be able to think differently about how we build things, not for their 15 to 30 year time, but perhaps for a far closer horizon?
That's part of our role too, as the department, to continue to try and really make that engagement with Infrastructure SA as positive as we can do to ensure that more holistic view is advocated almost on our behalf as well.
I consider the future of healthcare design is not actually in the medicine or the buildings we create, rather the relationships that occur in between. I also think the Health Infrastructure Arts program is a glowing reminder that these are low risk, low cost, high joy opportunities for us to embed that sense of relationship in our future healthcare design.
The environments we create, they do something. They have the ability to stimulate memory, learning, social interaction, and improve medical outcomes. The spaces that we are within are the things that begin to treat us and feed us. We need to track a new path forward that begins to look at the spaces we create as a health-generating system that have significant impact on our psychology, our physiological, and our biological health.
What I'd like to argue is that it should be a much more joined up process. And so rather than passing the baton at every stage of the process, according to usually a project assurance framework or a gateway project, that actually the health service planners are actively involved all the way through, together with the clinical planners, together with the architects, to get the design solution that actually addresses the health need that we were originally setting out to achieve at the start.
And so I think as we look to the future, one of the critical things is going to be actually building new capabilities within our systems, not just in service and clinical planning and doing a more joined up job throughout the process, but also enriching those capabilities with really effective data science and data governance capabilities that allow us to really match and link data across care pathways and to make much more insight-led decisions about the way in which services can be created and the modelling that we can do to understand those outcomes.
Yes, you can have standardised care. We want to provide safe care, quality care, best care, but specifically we want to provide person-centred care. We shouldn't be providing the care that we think the patient wants. We should be providing the care that they actually want in the environment that they choose to receive that.
So I think the figure for us as citizen scientists, quite frankly, is how do we become part of the stakeholder community to be part of the solution? And let's face it, whether we work in public sector or in private sector, we all work for companies who quite frankly could step up into this space.
It's super exciting to think about some of the partnerships that we can actually advance our hospital precincts to move into that health and wellness precinct and having it much more a community type space than that sickness treatment space, which I think presents some super exciting.
It's been fantastic. I think it's a great group of people and it's lovely to network and share ideas in a really open environment.
I love that there are lots of female speakers and I love that we are constantly talking about the consumer. We need to talk in engagement early on and continuous.
I think Ty's a wonderful presenter and I'm really looking forward to learning more about his work.
A great event, great variety.
It's been good. It's been really good to soak up the conversations that are happening in the sector and meet some new people. it's really important that you are listening and that not so much talking, but listening.
Community is a big element of it, so connection, consultation.
If you're involved in anything to do with health planning across Australia or across New Zealand, that this conference provides amazing opportunities to network with some people doing some really dynamic pieces of work.
Now, I don't know exactly what the future looks like in this space. It's very much in its infancy. But certainly you're going to see that if we have to wrap our clinicians around our patients, the patient experience is going to look a little bit different.